All right, so we are looking at the epidemiology of respiratory distress syndrome. We're not history students or geography students, but for every disease condition, we try to look at the overall. You understand? Looking at the overall is more of okay, to what extent has this disease condition actually affected people worldwide? Okay, so for respiratory distress syndrome, the epidemiology, we said that it actually varies depending on whether, you are looking at the one in newborns or the one in what? Older children or adults in general. Okay, so the ones in newborns, we said that this one primarily affects children that are born before their time. Okay, so children born before their time are the ones that are mostly affected. So incidence is inversely proportional to gestational age. That means the lesser the gestational age, the more likely the child is to have this disease condition. Okay, so 60 to 80 in children that are less than 28 weeks, 15 to 30% in children that are between 32 to 36 weeks. Okay, so risk factors, prematurity is one there. Okay, occurs mainly in male children. Okay, maternal diabetes, cesarean delivery without labor. Okay, perinatal asphyxia. Okay, so why use of antenatal corticosteroids and surfactant therapy? That's from outside, you are trying to actually replace this natural surfactant that should be in there. That thing has actually reduced the risk of the child dying from those conditions a lot. Okay, so acute respiratory distress syndrome occurs in about 10% of patients that are so ill. That's we are looking at the ones in adults now. So if the patient is being supported to breathe, occurs more in them. Okay, so it occurs about 5 to 79 per 1,000 people. Okay, in a year. All right, that's people that have had respiratory issues. Okay, that's people that have been critically ill. Okay, so mortality rate is about 30 to 50%. So mortality remains elevated despite advances in care. That's for adults. Okay, then COVID-19, when it was popping up, it increases the risk so much. Okay, so common risk factors if you already have some underlying issues. Okay, like pneumonia, non-pulmonary sepsis, aspiration, trauma, if you have had transfusion, pancreatitis, if you almost drowned, then you had inhalation injuries and all of that. Okay, so that's it for the epidemiology of respiratory distress syndrome. Just looking at the rough how this disease condition has affected us, and to what extent.